So the bone, the fat pads are right on top of the bone in those areas?
Yes, yeah, stick to the bone. They are
Okay.
not mobile, they are stick, they are not moving with the facial expressions.
Right.
So we need to go deep. Why? We will see on the, for the T-drop, for example, when you start by the medial sheath, your cannula or needle has to touch the bone, because in the medial sheath, if we look at the profile like this, you will in the middle. So if you are not touching the bone, you are injecting above the malar septum and can press the lymphatic system.
Okay.
So these ones are highly mobile. If we inject only on this layer, a heavy product, when your patient will be smiling, you will have like 2 balls here. The green will be for the superficial, and we can choose the yellow for the intermediate layers. Okay. The white for me will be for botulinum toxin. Okay. So now, if we want to start by the forehead, we have two options. We have
Yes, super. Okay, yes. You do it like around.
clockwise, 1 p.m., 2 p.m.
Also, the superficial fat compartment that is really thin. Look, under the superficial fat compartment, you have attached to the muscle. This is, look, is forehead muscle here. You can see that is pink, right? Then under the muscle, you can find, because you can see.
To the opening.
Yeah, and to mark.
And to mark if it's needed, okay?
Yeah,
So
blanching.
otherwise you keep
down.
concentrated, because you know what happens when you inject. Your patient is talking to you about the husband, the kids, okay? They will try to remove your concentration, so it's better to have some marking that show you where is the opening.
So now we try to have a 45 degrees wiggle.
Exactly. As we did here, I'm doing the same, using only my cannula to release the skin insertion of the ligament. And if I'm using
Could be
a
painful.
biostimulator like this,
I would pull it up, I got you.
yeah, it will not give any, volume
No
or
volume,
something.
but it'll give
Just a
different
slight
profile.
eversion on the profile, but I cannot inject botulinum toxin with fillers
Right.
like this. So now it's more comfortable for my wrist to inject like this. I enter perpendicularly here, and I push under the dermis. I'm not injecting, you see, I'm just trying to find my direction. So I turn her in front of me, I check the level of my jawline. If I'm injecting here, it's too low. If I'm injecting here, it should be nice, okay? So now a quick and homogeneous retrograde. Lifting up the skin always, retrograde, like this, losing a little bit of product. I can be even more superficial. I know that Danilo prepared very nicely the product, and you will have no white papulas because the area I want to inject here and here. Okay.
And now place.
Yeah, and slowly, when you feel here, when you are in the right place and you feel, then you can release and you can make a retrograde technique and inject slowly and retrograde. So hydration is only for
Yes.
hydration.
Your needle and the saline will go by itself. Then don't shake the vial like this. Can I have the vial that is already prepared?
And it's-
Is it like this? Can you see it right there?
Yeah.
The screen.
Okay. This is also one of my patients with an acute edema. First time she has been injected for the lips. Or after 4 hours if we are not reacting very quickly. So it's an orbital infarction following the nose filler injection. Don't panic. You have all the knowledge of the anatomy, of how to prevent and to manage, but you have to know the signs. Because if you have the first sign of the vascular compromise and you recognize this pallor, this livedo that you have immediately, then you can react, because also you have hyaluronase in your office. So you will solve the problem and you will avoid probably also the blindness by doing that. Because here you will be injecting inside the orbit but you need a small volume. You will not make a big pressure inside the orbit. And the idea will be to spray the orbit here in order to inject 1 ml of hyaluronidase that has 1,500 units that will be entering the intra-arterial wall and spreading hyaluronidase and reducing that. So what you must have in your office is that emergency kit, so we call it the ECAMS fillers emergency kit, and this is what Danilo will show you just right now. So you will inject with a needle, you cannot inject hyaluronidase with the cannula here, so you will inject in all the areas of the compromise, especially around the supratrochlear arteries, and you will inject your hyaluronidase in all the territory.
You don't
Completely.
need.
Okay.
No, you have to go because you use the needle like.
You use this size needle for the
Yeah,
to do it?
Could be enough. Yeah.
yeah.
This is a guide for you to tell you F is for female, M is for male. So it gives you the indication. The SML is if you think how much volumizations the person needs. For example, so it would indicate to you which are the area that you should.
Okay, when she's smiling also with her eyes, so we have some crossfit lines also that we can treat.
Bring something out, so I give more light to make it come forward. Okay.
Our filler
Going
going
right?
lateral to the supraorbital
and straight.
pedicle and injecting below
So-
the muscle.
What I would do, I would do this one right here. Because